record show we have 4 of our 5 members here. Dawn Longman, they had to make a trip to Billings. She's on her way back right now. She doubted she'd get here at 2:30. We could call her if we need her, but I don't see why we should. All right, the reason we're here today is about this letter of intent, but we're going to just do a little bit of housekeeping first. You all have seen the minutes of the last meeting. Does anybody want them read, or would you entertain, if not, a motion to approve them?
I would move to approve them as submitted.
Second.
Moved and seconded. All in favor?
Aye.
Opposed? Motion carried. Any correspondence? None. Old business, other. We go on to our new business, and that's this non-binding letter of intent between Billings Clinic, Townsend Health Systems, and the District Board. As you all know, Billings Clinic is interested in partnering with us, and we're very happy about that, or at least I am for sure. I think maybe you all are. Now, this was a non-binding letter of intent, but there are two things in here that are binding, and that's why we have to have this meeting. As you know, at our last meeting, you gave me authority to negotiate with the provision that all that's gone. Aye. Anyway, with the provision that all binding agreements have to be okayed by the board. And there's 2 things in here that are binding. On page 2, under proposed transaction, subsection B, the duty of good faith is binding on the parties. Well, that's binding, so we're bound to deal in good faith. I know who this is. Hi. Hello. It's in the Broadwater Health Center conference room. Yes. I don't. Anyway, don't bother me now, okay?
Must not have been done.
It says 110, 110.
Just wanted to disclose that
The notice says 110
Jim
East
Duncan
Street.
and Dr. Clint Seeger are on the conference call as decided by...
Hang on, Jim. Let me turn the volume up a little bit, and you can go ahead and introduce yourself to the district board.
Yeah, I just wanted to make sure you knew I was listening, and Dr. Seeger and I. So this is Jim Duncan, Billings Clinic Foundation President, and Dr. Clint Seeger, Chief Medical Officer of the region for Billings Clinic. And thank you for allowing us to be on the phone. We're delighted to be part of the conversation.
Thank you very much. Glad to have you here. This probably is going to be a short meeting, but maybe not. Hello, Daryl. How are you? Daryl walked in, and it'll probably be a long meeting now. Anyway, the subsection B, the duty of good faith is binding on all parties. And then on subsection D, it really requires us to deal only with Townsend Health System. So I'm not sure what that subsection means, but I think it does bind us to something. And so there we have it. Now, I think you've all read through the whole 9 yards of the binding letter of intent. I think it's very favorable, and it's going to be good for the Billings Clinic, and it's going to be good for us. Do we have any questions, or otherwise I would entertain a motion to give me authority to sign the letter of intent?
On the first page, on the next to last paragraph,
Yeah.
the third sentence, it says, in addition to operating BHS, shouldn't that be BHC?
Give me that again.
Page 1.
In addition to operating, BAC. Should be BAC. There are a couple typos in there. Good catch.
On the second page, part E,
Part E.
yeah, the first sentence, I really don't understand it, but I do understand how it relates to part D.
You know, I've read this contract about 5 times, this letter of intent. There's a lot in there that I don't understand completely.
So what's your question? What does that reference to 1D mean?
I think I see how it is related to 1D, but it's just an awkward sentence.
I thought it was very long and very difficult to
work my way
understand.
through it.
It's referring specifically to that agreement in the first sentence of 1D, that the district and BHC agreed to deal exclusively with one another in connection with the proposed transaction and not to entertain offers or engage in other conversations, et cetera, with other entities. So that's
Binding is that.
that's basically binding, and then it's saying, in consideration for that commitment to negotiate only with Billings Clinic, in 1E, Billings Clinic is agreeing to provide some financial advances during the course of the negotiations as well as prior to closing. And that would get more into the conversation between THS and Billings Clinic, so I'd probably defer to Kyle or one of the other board members to go into more, if they want to go into more detail on that. That's how I read it.
It's the part that says, and ending on the later to occur of the date, where I start to fumble.
I did too.
But I agree with your interpretation, with what Corey said.
So what it's saying is, there could come a point, it says, see, following the date of notice by Billings Clinic of its intent to cease discussion, or October 31, whichever of those would come later. Make sense?
Yes.
Sorry.
Doesn't make a lot of sense. I didn't draft it.
If you go through this whole thing, you're gonna find a lot of sentences that you're gonna have to read 3 times
Yeah,
and look at what exactly does that mean?
but it's really pretty logical and easy to follow.
Yeah, it is.
I thought it was pretty well written.
But the whole thing is, this kind of sets the groundwork for where we start negotiating, and so that's what we're really doing, is saying, okay, are we gonna accept this? Or is this where we're gonna start? Do I have the authority to negotiate?
I guess I would point out one thing, just in terms of what the property that we're talking about. So the
Oh, yeah.
property they're talking about specifically is
Right.
this area right here. It's literally 5 lots in block 15. And then the paragraph before that on page 1 says, the district owns other real property and improvements which they may or may not acquire from the district. So we know we have that other lot, we refer to that as Grover Building or something like
Well,
that.
there's the Grover Building's across the street, and then there's the ambulance building on Broadway. And the lot next to that is owned by the county, that's used as a parking lot.
Right. It's-
And I think that they would be ideal lots or facilities for a clinic, and I wouldn't be surprised if Billings Clinic may want to talk about acquiring those properties. If you would involve both the county and the district. As you know, all it's going to be remediated. There's building is going to be torn down, and the soil is contaminated with petroleum products, and it's going to be cleaned up. And apparently, with no cost to either the county or the district, it looks like, thanks to the State Petroleum Board and the Department of Environmental Quality and a federal grant that comes through the what they call the Greenfield program. It's kind of a win-win for everybody. So, because right now the properties are, I think, a liability, and so once they're cleaned up, they will have some value. Who knows at that time if Billings Clinic will want those lots? And I suppose what we want to do at that time is get an appraisal and see what it is and go from there. I would guess that's what we're going to do. But right now, we're dealing only with this building here. This building and the lots on them. As you all know, they're going to require significant maintenance on this hospital, on the building itself. And in there, what they're contemplating right now is that in exchange for the they would pay off the warrants, our registered warrants, which now run about $490,000. I see it wrapping all together though as one big package. It goes on the buy, whatever we can. That's to be negotiated on the buy-sell agreement. favorable to Billings Clinic and to us to have that transaction come across. I don't see we have anything to lose and everything to gain. I'm quite happy. Anybody have any questions? Or would I entertain any public comment from anybody? Any thoughts? Yes, Tim?
Just a quick question, Mr. Chair. One of the reports that was in the Broadwater Reporter was talking about a clinic opening as well in Townsend from St. Peter's Health.
Yeah.
And if you would possibly have any comment or input on that as far as, is that going to have an impact on this?
I have no comment on it. I certainly would impact who knows how it would work, I don't know, but I have no comment on it.
Okay.
St. Peter's is certainly welcome to do whatever they want to do as far as I'm concerned.
Are they going to be working with the district to establish that?
I'm not working with the district, I don't see now. At one time when we were considering St. Peter's and we were talking to them, but they just didn't come up, we couldn't get any really answers out of them, so moved on.
Thank you.
You're welcome. Yeah, Sherry.
I'm wondering, is their intent also to keep our nursing home? Not just the hospital, the whole facility?
My understanding they are. You, Kyle, is that right?
Yes. The answer is yes.
It's in the letter of intent that they're intending.
Okay.
But coming down to the negotiations, I don't know. I think it's pretty wide open on negotiations. But right now, it's my understanding that they do want to keep the nursing home. That's very important to us, I think.
It's very important, I think, to our community and to this county and
I do too.
surrounding. How long is this letter of intent for? I mean, how long are you?
The letter of intent, they're looking at the closing on October 31st, on or before that.
Awesome.
So we want to get this transaction done promptly, if we can,
Right.
For good reasons. Yes, Scott.
I don't know, Jim or Dr. Seeger, if you want to comment on that question or if you could hear the question.
Yeah, we could hear the question, and there were several. There was about the land, about the nursing home, about St. Peter's. Which question would you like us to address?
Nursing home specifically?
Yeah, I'll let Dr. Seeger comment on that, and then I want to comment on the St. Peter's one too.
Yeah, so we've had, several conversations, and we know and understand how important the nursing home is to that community, as with every rural community that has a nursing home. And we have, as we've discussed, there would be no intent to remove that nursing home in the foreseeable future. That's not something we know that's important to the organization and the community.
Yeah, and just to tag on to that, and for those of you who were at our presentation, our goal is to work with all of you, the existing board, the district board, the community, to try to just get things sustained and then to seek growth opportunities for the community to sustain healthcare as a service to the community, but also as an economic tool for a driver for the community. And so, there's a lot of moving parts to all of this, but we really need everybody kind of rowing in the same direction to work with us, with the community, with everybody to make sure we're doing the right thing. And so I think I serve on one of our boards in one of our outlying communities that has another clinic in that town. We work with them. I'm not saying it's impossible to have one. It just adds complexity to it because we kind of need every possible resource we can get to make this as successful as possible. So we want people to get their health care in Townsend, to be hospitalized in Townsend when they can be, to be in our nursing home when they can be, to have their labs and all that. So our goal is to strengthen what services you have in that community and get everybody else in the community trying to move toward that goal.
Thank you very much. Any other comments?
I'm really excited about this. This is going to be great.
I think so.
It's going to be good for us. And I I can hardly wait to get sick.
Well, I put a doctor in the room, so we'll make Dr. Steger help take care of you. But I made this at the board meeting when we were up there a couple weeks ago. We'll need all of you to be as engaged or more and as involved or more moving forward as we roll up our sleeves together to try to tackle these opportunities and turn things in a great direction for Broadwater Health Center. So thank you for the opportunity, and we got a lot of work ahead of us, but we're excited about your enthusiasm as well.
Did you want to make a comment on the St. Peter's question?
Kind of wrapped into what I said. You know, if they build a clinic there, this is me, I'm not an expert on this, but we live every day in our world of competition. It gets a little harder when the town gets smaller and the number of bodies you're dividing up between who can come and help you thrive are divided. So I guess my thought is, I'll let Clint speak on it. I guess if they come, they come. I hope if they come, they will refer to us, to our community hospital, let us do the things that help patients heal closer to home, like rehab and blood work and x-rays and all those things. I don't know what they'll all do. And that when it comes time, as I said, to admitting someone in the hospital, if they can put them in our hospital in their hometown, do it, please. Maybe there's a way we can talk with them about saying, perhaps there are some ways we can work together to avoid a lot of duplication. But our goal is Townsend. Our goal along that journey will be to work with everybody, whether it's St. Pete's or other players, to try to help us pull together to have a very good healthcare organization, clinic, hospital, nursing home for that community. We need everybody's help to get there. So Clint, maybe you want to add?
I wouldn't add anything, but just sort of echo, and that's just our model. We're going to do everything to partner. If there's some conversation that can be had up front to maybe look at the ways that we can partner without somebody putting a clinic in place or throwing resources at something without really thinking things through and not thinking in the interest of the community. We're gonna have conversations and try and keep the focus on what's best for the community of Townsend.
One of the things that has helped make or break some of our other affiliates, and the one I'm on the board of, is Billings Clinic is doing everything it can to get patients out of Billings Clinic's hospital and back into the local community. You have a program like that. But the more we can try to get outreach, specialty clinics, things happening in that community, that's what it's going to take. It's not going to, if everyone wants to drive out of town for every little thing, we won't survive. And so you're going to hear us, talking about ways to bolster what we have there. And that's what we need your ideas on, and your help. And as the facility needs help, will the community be involved? I mean, all kinds of things. So it's been working for us in these other 12 or 13 communities. Not that it's not a struggle in some of them. Rural healthcare is tough. But we're bullish on Townsend right now, and we're hopeful the community will rally behind all of our efforts.
Thank you very much. Where are we? Did we have a motion? We don't have a motion.
I will move to allow Q to negotiate on behalf of the district, hospital district.
Well, I'll take the motion, just first off, sign the letter of intent.
Yes,
I think that
I would move to sign the letter of intent.
I would second.
Moved and seconded. Any further discussion? All in favor?
Aye.
Opposed? Motion carried. All right. Anything else? Anything that we are out of the agenda? Any other business? Any discussion at this point?
But you asked to be authorized to sign.
Yeah, the letter of intent.
just want to make sure that when we do a deal with St. Pete, the purchase price of the hospital will be no less than the outstanding warrants at that time.
You know,
Yeah.
every month they go down. You know how much they pay a month?
Yes.
How much they pay a month?
It's a little over 13.
13. Well, that's a starting point. I mean, I'll come back and let you know where we're at all the time. But you want a motion to be no less than that?
So that resolution that was passed so that he can negotiate,
Yeah.
yeah. So he doesn't have to ask.
Any agreement, binding agreement is subject to approval. Absolutely. Ken?
Just a real quick request, Mr. Chairman, in the interest of the public awareness, if you would work a little hard to make sure that we get advance notice out to folks about your meeting, hold regular meetings so that they can be apprised of what's
I
going on.
have no intention of holding regular meetings. I have intention of holding as needed.
That's where we've been before, and
Yeah.
it would be good to
I
keep
don't-
people informed somehow or another.
Unless this board wanted regular meetings, and I don't see a need for them.
Okay.
But I expect that as things develop in the next 2 months, we'll be meeting, and we'll give, at least the notice is required by law. The law itself doesn't say how much notice, but an Attorney General's opinion is held for, at least for county commission meetings, it's got to be at least 48 hours, is my understanding. So we'll do at least that.
Some regularity would help, that's all I
Well.
say. If possible.
Yeah. I see no reason for a regular meeting.
Okay.
One time we were thinking of having a regular monthly one, but we didn't. Any other comments, questions? I guess we can adjourn the meeting.